Good morning. This is a report on Ricardo Mendoza. Ricardo Mendoza is a 60-year-old male. He is a patient of Mara Matthews. He was admitted with a squamous cell carcinoma of the right lung and had a right upper lobe lobectomy. He was diagnosed a few weeks ago after experiencing shortness of breath, increasing fatigue, loss of appetite, and a 15-pound weight loss. Ricardo's wife, Adelita, is supportive and very involved in his care. He has no known allergies. He is a full code. His last vital signs were a temperature of 98.0, blood pressure of 128/74, heart rate 84, respirations 20, and he's satting 94% on 2 liters nasal cannula. There is an order to keep the oxygen saturations above 92%. His last pain rating was a 2 out of 10, and he received 2 milligrams of IV morphine 1 hour ago. He is receiving albuterol nebulizer treatments, and the last one was this morning. He's tolerating those well. He has a right AC 18 gauge IV, running D5 in lactated ringers, infusing at 125 milliliters per hour. He has a right chest tube to negative 20 centimeters water seal. It is draining about 300 milliliters of serosanguinous drainage. The dressing is clean, dry, and intact, and the insertion placement is about 20 centimeters. He has a surgical incision to the right axilla. Dressing is clean, dry, and intact. He is on clear liquids, and the order is to advance as tolerated. He is out of bed with the assist of 1. He is in standard isolation precautions and is a high fall risk. Neurologically, he's alert and oriented. His heart rate is regular with a normal rhythm. Respiratory, he has crackles in the lower lobes and decreased sounds on the upper right side. He's been voiding in the urinal, and bowel sounds are present. His skin is intact except for the chest tube site and incision site. He is again out of bed ×1 for transfer and ambulation. He is pleasant and cooperative. Post-operative chest x-ray last night showed a right pleural effusion incidental to the operation. Patient has just returned to his room following a follow-up chest x-ray this morning. The patient is progressing well per expected post-operative recovery with no complications. We are doing standard post-operative care. He was just transferred back to his bed a few minutes ago, and I told him you'd be in to check on him soon.